Hello, my name is Fraser Ratchford, and I'm with Canada Health Infoway's Consumer Health and Innovation Program. I want to welcome you to this talk on privacy. Canada Health Infoway is sponsoring the ImagineNation Outcomes Challenge, which you can learn more about on our website. And as part of the challenge, we are fostering a community of innovators. We have sponsored this series of education sessions to assist clinicians, staff, and their patients in increasing the use and spread of innovative health solutions. Joan Roch, our Chief Privacy Strategist here at Infoway, will lead this session on privacy. So without further ado, here's Joan on what not to share.
Thank you, Fraser, and hello, everyone. As the Challenge Handbook says, information and communications technology has changed the way we live, work, and play. And what I want to do in the short time we have together is to illustrate how information and communications technology in the healthcare delivery world has created new privacy risks that we need to be aware of and to manage. And rather than giving you a possibly dry session on specific privacy provisions that are in law or features in the EHR architecture, I thought it would be fun to illustrate what I'm getting at by looking at some real-life privacy breaches. I think the breaches do a great job of bringing life to privacy issues that I want to highlight. Now, they're real events that happened in Ontario. They involve real people, and they give great insight into some of the challenges we're facing in the technological world. What I need to underline before we start is that even though they are cases from Ontario, similar situations are occurring across the country. I want you to take away from this session about 7 things: the importance of considering the human factor in technology, the importance of considering your approach to role-based access, of having audit trails turned on, of having clear policies in place, having continuous privacy training, and sanctions for misuse and inappropriate use of information communication technologies. I want us to leave this session with a sense of why it's so important to our EHR initiatives that we spend time on privacy during the development, deployment, and operation of these systems. So with that backdrop, let's look at what not to share. Similar to the popular TV show, we're going to start by looking at the current wardrobe. And for our purposes, that will entail looking at the pieces of the story that led to the breach. We're then going to see how we need to adjust the wardrobe to stay up to date with current fashion. Of course, in this case, it's going to be what we learn from the breach and how we need to adjust our work in the current information technology communications environment, basically the reveal. And then I'm going to share some information about some recent privacy surveys that have been done, which really give a good description of what Canadians want and don't want. The first case I want to talk about is HO002, and that stands for Health Order Number 2. It actually dates back to 2006. Now, in this case, the complainant was admitted to the hospital. She and her husband had separated, and her estranged husband was an employee of the hospital. She didn't want her estranged husband to know that she had been admitted, and she advised the hospital of these wishes. Now, the estranged husband had a new woman in his life, and she happened to be a nurse at the hospital who had access to electronic records. Now, after the complainant was discharged from the hospital, she discovered that her husband had information about her treatment that she did not expect that he should have. And she notified the hospital of her feelings, and they conducted an audit. Now, the results of the audit did establish that the nurse girlfriend had accessed the complainant's personal health information even though she didn't have a need to know. The IPC, that's the Privacy Commissioner's Office, ruled in this, or found in this case, that the personal health information of the complainant was used and disclosed in contravention of the Act. They also found that the hospital failed to take steps that were reasonable in the circumstances to ensure that the personal health information had been protected against unauthorized use and disclosure, and this was in breach of another section of the Act. And consequently, the commissioner actually ordered the hospital to implement protocols that would ensure that reasonable and immediate steps were taken once they were notified by the individual that they wanted their privacy protected. And they were also ordered to ensure that all employees of the hospital are appropriately informed of their duties under the Act. I'm going to save the reveal on HO 002 until we look at the next order. Now, this breach occurred in 2010, 4 years later, but unfortunately the situation is remarkably similar to the one that occurred in 2006. In this case, a diagnostic imaging technologist was formally married to the current spouse of a complainant. The complainant had been admitted to hospital, and the hospital had an electronic records system. The complainant noticed after she was discharged that her husband had details about her care that she didn't think that he would really have access to. And she made a complaint to the commissioner's office. An investigation confirmed that the technologist had accessed the complainant's personal health information over a period of 9 months for no related purpose, and further that the individual had no reason to be accessing the record without the complainant's consent. The technologist was not involved in the care of the individual and really had no reason to be looking at the individual's record. The investigation conducted by the Privacy Commissioner's Office revealed that although existing policies were in place, they had been reviewed and revised based on the previous order, and further, they had taken efforts to educate the agents of their obligations under the Act. Nonetheless, it was clearly evident that the hospital's policies were not being followed. The actions taken to prevent the Ottawa Hospital staff were not effective. The Act actually requires that a custodian is to take steps to ensure that personal health information is protected against theft, loss, and unauthorized use or disclosure, and to ensure that the records are also protected against unauthorized copying, modification, or disposal. The Act also requires that the custodian have in place information practices that comply with the requirements of the law. Now, the hospital had a great series of policies in place. In fact, it had a good policy to the effect that access to confidential information would be limited only to those employees who were authorized to hold, view, or handle such information. But the investigation revealed that there were a number of issues that actually made it difficult for the hospital to ensure compliance with their own practices. For example, despite the policy statement, there were actually few controls in place that could or would restrict staff members from accessing information. The role-based access controls that were in place were very limited and very gross in their application. Consequently, most staff who provided any care at all in the hospital had access to the electronic record system and, in essence, had access to all the information in that record. The hospital system also had the option of a VIP warning flag being placed on the record. But all this did was to block access by a staff member, not just to that record, but to all of the electronic systems that were in the hospital. In essence, then, it would have meant that the individual could not have performed any other duties as an employee of the hospital, even though the access should only have been restricted to one record. The hospital also had a policy in place that stated that audits are conducted on all the hospital records. But in fact, the investigation revealed that there was no audit capability in one of the hospital systems, and it happened to be the shared medical system that contained not only simple stuff like appointment information and some contact information, but also all of the doctor's reports. So the commissioner in her findings recognized, technology can't solve everything. She recognized that there are limitations on what technology can do. But she did suggest that the hospital organization really take efforts to ensure that they had other measures in place that would limit the access to the record and the information in the record. She also noted that it was about time that there had been a cultural shift, or that there should be a cultural shift to foster more of a culture of privacy in the Ottawa hospital. Okay, can we take a break?
Sure.
Okay, good. These two breaches highlight the increased accessibility of information in an electronic environment and the importance of role-based access and their limitations, the importance of having audit functions in place in all systems and having them active. I understand that there are some organizations, not necessarily in Ontario, but in another jurisdiction, which actually ended up turning off the audit function because they said it took up too much computing power. But as you can see from the breaches that we've just discussed, unless you have that audit function on, it is almost impossible to figure out who touched the record and when, and that has always been one of the features that we say is so fabulous about electronic health record systems. Another learning is that there will always be human factors involved. Complicated personal relationships have been around forever, and I expect that they will continue to be around forever, as will human curiosity. So we need to build systems, and we need to undertake our privacy training programs so that we can take this into account. And it's also really important to build a culture of privacy that highlights the special nature of the electronic ecosystem through continuous staff training that enhances awareness and understanding of these policies, the obligations, and the sanctions that will result if there is abuse. Some of the hospital, well, not just hospitals, some of the organizations that I've looked at are now starting to include awareness of privacy principles in the performance reviews of their employees. The third order was out of Sudbury, Ontario, and it dates back to 2007. And it actually involved a methadone clinic and their use of wireless devices. What happened was that an individual, much to his surprise, captured an image of a toilet in a washroom on his vehicle's backup camera while driving by the clinic. And much worse than that, he captured the image of a woman using the toilet. Now, he was so surprised, he contacted a reporter from the CBC. I don't know why he first went there, but that's what he did. And the reporter was sort of taken aback by this situation and ended up contacting a private investigator to verify the event. So the reporter and the private investigator stopped at the clinic in a vehicle with a backup camera. And lo and behold, the reporter and the private investigator saw on the backup camera's monitor the image of a woman using a toilet, which included a reasonably detailed facial image. Now, they stayed there a while, and the woman left the clinic, and when they saw her leaving, they went up to her and asked her about the experience in the clinic. And the woman advised that it was a methadone clinic and that patients are monitored while providing urine samples. They give their consent to do so. And they do this to ensure or provide evidence that the samples are not being tampered with. She also advised that she was aware of the surveillance camera in the washroom and had given written consent to engage in this practice. Now, the CBC contacted the Privacy Commissioner's Office, who contacted the clinic immediately to investigate the situation. And the IPC also requested the clinic to immediately turn the camera off and contact the security firm to see what was going on, what the problem was. Now, the clinic felt absolutely terrible about this situation. They had no intent that it could be viewed by persons outside of the clinic, and they complied with the Privacy Commissioner's requests without delay and replaced the system immediately. They replaced it with a wired device. Now, what this breach demonstrates is that it's really important to comply with the privacy by design principles, and that is make sure that privacy is considered during the development, the deployment, and the operation of any new technological device that is being adopted by the clinic or by the hospital. And to conduct a privacy impact assessment before the technology is actually implemented, and to conduct a threat risk assessment before the technology is actually implemented. These kinds of tools, I know a lot of people just refer to privacy impact assessment as PIA, and short for pain in the ass, but in fact they are there for very good reasons. First of all, they help you identify the specific legislative base, the actual parts of the act that you need to comply with, and they also help to identify any of the privacy and security risks you may expect to find with this new system or new device as it's before it's actually implemented. And that way you can identify related mitigating strategies and ways of managing the risks. Now, the other thing that I want to mention about this situation was the role of the Commissioner's Office was actually really nice in this instance. They were on it immediately. They brought it to the attention of the clinic in a very nice, helpful way, and they were there. They are there not just to come down hard on mistakes that are made in the healthcare delivery field, but also to be very helpful. In this case, they actually had helpful resources and were able to help the clinic move to a more privacy-sensitive way of capturing these images. So that completes the description of the three breaches that I wanted to talk about. Now I'd like to just change gears a little bit and bring to your attention the fact that every jurisdiction in Canada has a number of privacy and health information laws in place. And this is another reason that privacy impact assessments are so important, because what it will do is walk you through the relevant pieces of legislation and the obligations associated for your specific application. And as you can see, it's not just a cookie cutter kind of thing. You really have to look at the legislation that's in place in your jurisdiction so that you can be aware of all of the obligations that you have. And what I wanted to emphasize as well is that sometimes people think that we privacy people are just a little bit over the top in terms of wanting privacy to be attended to. But we do conduct surveys on a regular basis to find out what it is Canadians think about A, the Electronic Health Record Initiative, and B, about their privacy in relation to the record. Now, what's really fabulous is that all of the surveys demonstrate that Canadians continue to support the Electronic Health Record Initiative. And in fact, since 2007, since we started, 2003-04 in fact, when we started doing these kinds of surveys, the amount of support has actually increased from one survey to the next. So that's absolutely fabulous. And Canadians really believe, as do I, that electronic health records will increase the effectiveness for doctors, pharmacists, nurses, just generally for helping us provide care. At the same time, however, they are aware of some of the privacy challenges associated with these records. And they do have concerns that their information not be used for malicious purposes or used in unwanted ways, used for unauthorized secondary uses. And they have concerns that privacy and security procedures might not be followed. And as you can see from the breaches that we've just gone over, in fact, sometimes privacy and security procedures are not followed. So they've also identified in these surveys a number of measures for increasing their comfort with electronic health records. They've identified at least 8 measures that increase their comfort, and what's really interesting is over time as well, support for these measures since 2003 has increased. And what's even more fascinating is that the population that has had experience with electronic health records, and this would be primarily people in the province of Alberta, support for these kinds of measures is actually stronger than in other populations. And the types of things that they regularly say increases their comfort are the fact that these electronic systems have audit trails in place, so that they can know who touched their record and what was done to it. That's always number one. They also want to see strong penalties for unauthorized access. And in a bizarre sort of way, I am happy to say that we are starting to see some very strong sanctions being levied against people who are inappropriately accessing or using information that's held in electronic records. Perhaps on another session I can share with you some of that information, but people who have inappropriately used the records in Alberta have had financial penalties and even have had very strong financial penalties levied against them or have lost their jobs. Another thing that the public wants to see is they want to be informed of privacy and security breaches. They want the ability to access and verify and report corrections to their records. Again, they want clear privacy policies in place. So this is just a list of the kinds of things that Canadians say would increase their comfort in having information stored in an electronic manner. So in summary, Canadians appreciate the potential benefits of EHRs for the overall effectiveness and efficiency for the health system. But respect for their concerns about privacy really needs to be taken seriously. And we need to do that by ensuring that privacy is built in to the systems that we create, and it's built throughout the systems that we create. We need to ensure that there are tools and resources in place that help identify privacy and security risks. Using, the PIAs and TRAs are really, really important tools. And we need to have tools and resources in place that can help identify unauthorized activity. And we need to ensure that we continue to build and maintain a culture of privacy in our EHR initiatives. We have to maintain the trust of the Canadian public in this initiative. So thank you very much. That concludes the information that I wanted to share with you. I hope you found it a little bit entertaining and that you came away with the sentiments that similar to mine, which is why it's so important to address privacy in the EHR initiative in Canada. We need to do that to ensure that we keep their trust and thus continue to keep this initiative moving forward. Thank you.
Thank you, Joan. We appreciate hearing your thoughts on what not to share. If you're interested in hearing more of our talks, please visit the Challenge website at ImagineNationChalllenge.ca. Registration for the Outcomes Challenge continues until March 2013, so if you're currently using one of the technology listed, I encourage you to join the challenge and reap the benefits of participation. Thank you for watching.